transmissible Delta COVID-19 surge. But amid the declining numbers, will this be enough reason to Professor, welcome as always to The Source and maraming salamat po sa inyong oras.
Yes, good morning, Pinky, and good morning to The Source. Thank you as always for inviting me.
And you come with great news. Di ba? Average sa Metro Manila is about what? Now, weekly average is what I heard about 1,900, if I'm not mistaken. And maganda po dito yung reproduction rate is at 0.61 rather.
Yes, that's great news, Pinky. It actually readjusted to 0.62, but it's not a big deal. And the everyday average is, yes, about 1,900 plus. So in context, this is the lowest 7-day average since the week from July 31 to August 6. What's the relevance of that? That was the week before we had ECQ. So in other words, we have reversed the number of cases to the week before ECQ or week when we started, before we started ECQ. And that's good news. And hospitalizations going down. Our positivity rate is now down to just 12%. I think maybe later this week, it could be down to 10% or maybe early next week. And although 5% is the target, 10% is an acceptable positivity rate. So
I heard an interview of yours. You said hindi lang kasi siya drop. Parang ang sinabi niyo, it was a significant drop.
Yes, it's like Pinky. I mean, the decrease is very fast. I mean, it's decreasing by 30% every week. A decent decrease would be 20%. And I think the level of vaccinations is helping it decrease very, very quickly compared to, let's say, March, April surge when we had the alpha beta variants. We didn't have a significant level of vaccinations yet then. So the decrease was slower. Of course, other interventions help. We know that because where they don't have or they stop wearing face masks or doing social distancing, they're still having spikes in cases. So sa atin, Filipinos in general are very compliant naman when we say wear face masks. 90% of people wear face masks, and this is good. And then of course the local government, they play a role in these localized lockdowns because it helps prevent a spread of cluster of cases.
What are your thoughts though now on possibly downgrading the alert level from 4 to 3? Would it be time to do this come October 16?
Yes, we actually think it's time to do this. In fact, but I want to make it clear that this is based on our metrics. This is not necessarily the same as what the IATF or the Department of Health is using. The body, they will make these recommendations based on the metrics that they're seeing, but based on our metrics, at least on our research. What we're seeing is that actually, first week of October, it was already possible, in our opinion, for a relaxation to alert level 3. Now, even alert level 2 is possible right now. But of course, I'm sure John will be talking about these. But at least in our monitoring, what we see is that NCR is moderate risk. And what should moderate risk be in terms of alert levels? Our opinion is that it should be at alert level 2 or at the very minimum 3.
What kind of numbers are you looking at in November kung magpatuloy po ito?
Well, thank you. For starters, we think now before November, the 7-day average in the NCR would be down to less than 1,000 cases per day. If we recall, before the Delta surge, after the Alpha and Beta variant surge in March, April, close to 5%. And then hospitalizations continue to ease up. So it might be that by November we're already at low risk.
Mhm. By November, low risk na. Now, the projection of Okta is we are at moderate risk, and then sa November po, low risk na. Just wanted to get your thoughts on some of the healthcare workers saying that, wag tayo magmadali sa pagbaba ng alert level because marami pa rin yung mga pasyente that are in ICU at the moment.
Well, that's true, Pinky. But among the indicators, well, the ADAR is decreasing, the daily attack rate is decreasing. Yung positivity rate is it's close to 10%. If it goes down to 10%, it would be at moderate. In fact, pati yung ADAR is close to moderate. Right now, only the ICU occupancy is still at high, but it is already decreasing at the moment. We're seeing that because we have dipped below the surge capacity. And the overall healthcare utilization rate is in Metro Manila, I think it's 49%. That's already at low. So yes, we understand the concerns of the healthcare workers, of the frontliners, but at some point we have to strike the balance. If there is significant risk that they could be overwhelmed, then of course we would recommend accordingly. But right now we are not seeing this possibility. Or, I mean, it's possible, but we are just, in terms of probabilities, we just don't think it is likely at the moment because we think that we're already at the tail end of the Delta surge.
What about the vaccination of the 12 to 17-year-olds? This will begin on Friday, and likewise, of course, the general population. How big of an effect would this be on the numbers we're seeing right now?
Well, that would help, Pinky. Of course, we're not seeing that big of numbers in terms of cases for 12 to 17 because we have been restricting them from going out. No face-to-face classes yet, but it would be big in terms of the forward-looking in terms of what we plan to do by 2022 if we plan to reopen face-to-face classes, which would also be big for the economy. It's very important, and it's very important also for the mental state of the children. So I think we would definitely need to be vaccinating children 12 to 17 if we plan to reopen face-to-face classes. But in terms of the numbers, definitely it will help. And maybe it will help us also reduce mobility and restrictions to those 12 to 17 years old. I mean, they could probably start going to malls once they're vaccinated, etc.
Okay. Another point I'd like to raise, Professor Guido, is any red flags you're seeing at the moment in terms of how the numbers are progressing. And a point I'd like to make is some of the concerns that a lot of millions have been vaccinated with Sinovac rather, during the months of March, April, and May. In fact, the bulk of our vaccines really is Sinovac. And there have been studies even coming from the vaccine expert panel of booster shots. The point I'm trying to make is possibly po, if we were to believe the data, in 6 months, somewhere around there, 6 to even 8 months, the efficacy wanes. So kapag hindi po mabigyan ng booster itong mga milyon-milyon na nakatanggap ng March and April, kasi by December, yun na po yung 6-month period nila, would this be a game changer in terms of the numbers we're seeing?
Well, I'll answer first, Pinky, about the red flags. Right now, we're not really seeing our red flags. I mean, of course, we will still have, even as we ease restrictions, we'll still have to continue being vigilant and, to continue to observe these health protocols because we don't want spikes in cases or clusters of cases from happening, especially as, campaign season has probably started. We will have congregations of people. So we still need to observe public health standards to prevent, clusters and the outbreaks. To your second point, this is actually a very good point because we actually saw something similar in Israel they were the ones who started vaccinating early, I think even as early as December last year. And then they were able to control the surge once they got population protection in terms of the number of vaccinations. But then they started to have spikes in cases as well, possibly because they were ready to reopen fully in terms of, having no more face masks and no more distancing. But it was also observed that even other vaccines may have, a waning factor. That after 6 to 8 months, as you mentioned, the efficacy starts to decrease in these vaccines. Not all vaccines, but some, as shown by data. And that's why I think it is very important for us to definitely consider these booster shots, especially for those who got vaccinated early. My understanding is that most who got vaccinated at the start, March, April, May, were frontliners, healthcare workers. And it's important anyway to vaccinate healthcare workers, and then senior citizens possibly, and those who were in priority groups. So definitely this needs to be looked at, and I'm sure Concepcion, who's heading the acquisition, or not heading, but very much involved in acquiring vaccines for the private sector. This will definitely help in possibly giving booster shots to the community once the booster shots are approved.
Last question, Professor Guido. What's Christmas going to look like for us?
Well, Pinky, we're not seeing any red flags at the moment. And of course, you mentioned some concerns about waning efficacy. But overall, we think that it's going to be a good Christmas for us. I'm very optimistic that, it's not just the light at the end of the tunnel, but, we're seeing the end game. And that, as we saw in India, for example, they had the surge last March, April. It was a massive surge, Delta. Since then, they have contained it. They have had no resurgence. We're hoping, and I'm expecting to see the same thing in the Philippines, that once we're over this, it will continue. I mean, that would be good news for the country, for Christmas, in terms of there could be more gatherings possible, or bigger gatherings possible once once the cases are at a low number, when we're at low risk and we have more vaccinations. Not promising this yet, but I'm definitely very optimistic about December, even November to December, and on to next year. We could have face-to-face classes by next year, and this will all be a significant boost to our economy.
Professor Guido David, thank you so much for your time.
Thank you as always, Pinky. Good morning.
And we'll be taking a short break. Business groups are also calling for the downgrading of Metro Manila's alert level. Presidential Advisor for Entrepreneurship, Joey Concepcion, joins us after the break. Please stay tuned.